Optic neuritis. Example of a case would be like this. A 25-year-old female presents to OPD with history of blurring of vision and pain on movement of left eye. On examination, monocular superior part of visual field is lost. Pain preceded the loss of vision. Afferent pupillary reflex is impaired in left eye with normal fundus examination. Definition: inflammatory and demyelinating disorder of optic nerve. Etiology: it can be idiopathic, hereditary like Leber's disease, demyelinating disorders like multiple sclerosis, para-infectious like measles and mumps, infectious like syphilis and TB, autoimmune disorders like sarcoidosis and lupus, and toxic optic neuritis. Clinical profile. Anatomically, there are three types of optic neuritis: papillitis, neuroretinitis, and retrobulbar neuritis, depending upon the involvement. Involvement of disc in inflammatory and demyelinating conditions is papillitis. Involvement of disc plus surrounding retina is neuroretinitis. Involvement of optic nerve behind eyeball is retrobulbar neuritis. Typical and atypical optic neuritis. In typical, it is associated with demyelinating conditions. When it is not associated with demyelinating condition, it is atypical. Symptoms: it will be asymptomatic initially and there will be visual loss which is monocular, sudden and progressive. Dark adaptation will be reduced. Visual obscuration occurs. Movement and sound induced phosphenes. Episodic transient obscuration of vision. Depth perception is impaired and there will be pain. Signs: visual acuity is reduced, color vision is reduced, contrast sensitivity is impaired, and pupil shows ill sustained constriction to light. Marcus Gunn pupil. Ophthalmoscopic findings: there will be hyperemia of disc, blurring of the margin, edematous, retinal vein is congested and tortuous, sphincter hemorrhages occur, and exudates are seen. Visual field defects will be central or centrocecal scotoma. Differential diagnosis: it can be papillitis or acute retrobulbar neuritis. In papillitis, there will be papilloedema, ischemic optic neuropathy, pseudopapilloedema. In acute retrobulbar neuritis, it is malingering and historical blindness can be seen. Investigations: multifocal VEP or visual evoked potential, MRI of brain and orbit. Recovery and complications: the evolution of symptoms is visual acuity and color vision is lost eventually and it is progressive over 2 to 5 days. Recovery is slower, which takes 4 to 6 weeks. Complications are due to recurrent attacks, which leads to optic atrophy, papillitis, post-neuritic optic atrophy, and complete blindness. Treatment depends on treating the primary disease, which can be Leber's disease, multiple sclerosis, viral infections, syphilis, TB, sarcoidosis, or lupus. And corticosteroid can be given like IV methylprednisolone and IV dexamethasone. Interferon therapy is also done.